Joining us to talk about this is Dr. Warren Levy, a board-certified cardiologist and president of Virginia Heart. Thanks for being with us, Dr. Levy.
Happy to be here, Sandy, and happy to warn people about some of the risks of shoveling this very heavy, wet snow today.
Yeah, we do hear about an increased risk of heart attacks while shoveling snow. Why is that?
Well, unfortunately, heavy wet snow is actually known as heart attack snow because going out and shoveling is actually an extreme form of isometric exercise. Suddenly going from doing nothing without warming up to lifting heavy shovels of snow increases your heart rate and your blood pressure immediately. And for those who are at risk or those who have high blood pressure or underlying heart disease, especially coupled with cold weather, which causes your arteries to constrict, that can really be a terrible mix and can lead to a poor outcome, heart attacks or heart pain, which is called ischemia. And what we really need to know is that the heavy wet snow is a risk factor. And you need to get out and use a small shovel, do small amounts of shoveling at a time. Be sure to dress warmly, drink enough water. And if you're not feeling well at all, you need to go inside and rest.
And you say people recovering from COVID-19 should be especially careful.
Well, I think this year especially we need to be careful because everyone, because of COVID-19, has really become a little bit more sedentary. We're all at home. And suddenly doing an extreme form of exercise, this is sort of equivalent to peak exercise on a stress test, can put a lot of people at risk. Those who've had COVID have had lung issues and heart issues during their illness, and although they may feel like they're recovering, they need to be especially careful about going out and doing this really extreme form of exercise. You know, there are a lot of neighborhood kids who I think would love to make a few dollars. You know, get a neighborhood kid to shovel for you.
Okay, thank you for the advice, Dr. Levy.
Thank you, Sandy.
Cardiologist Dr. Warren Levy, president of Virginia Heart.